Welcome to the Hit and Run Medical Hour with Dr. Jennie Yates and Dr. Marc Blum. And now, here they are, Dr. Jennie and Dr. Marc.
Good evening. Welcome. Coming to you live from Clearwater, Florida. This is the Hit and Run Medical Hour. I am Dr. Jennie Yates, a chiropractor here with Core Health of Clearwater. My co-host this and every other Wednesday night is Dr. Marc Blum. Dr. Blum is a medical doctor. His practice in Clearwater, Florida encompasses everything from walk-in care to cardiac and pulmonary medicine. Together, we're answering your questions on health. And we're actually able to provide you both the traditional as well as the alternative view. Whatever your health question or concern, you get the best of both worlds from the Hit and Run Medical Hour.
Bring it.
Yeah.
It's good to see you, Dr. Yates. You look great this evening.
That is so kind of you to say. Thank you. Well, we have a great show for you tonight. Again, we are live. We are taking your calls. The phone number here is 441-3000. Tonight we're talking about nutrition, as well as I found a great article today regarding vices. And these vices are actually good for you. So 10 vices that are good for your health. How appropriate for us to discuss from both the, chiropractic alternative view, but also the medical standpoint.
I'm sorry.
No, go ahead.
Keep it going, Dr. Yates.
Well, that's all right.
I had an FWIW moment. Forgot where I was.
That's all right. So you've all heard about all of the news is about things that are bad for you, right? This is bad for you. Don't do this. Don't do that. There's always a study or a news report about things that are bad for you. And we wanted to talk today about 10 things that you may consider bad for you that are really good. And actually, Dr. Blum's having some coffee right now. Coffee's on the list. We'll talk about that. The first one up tonight is getting your Z's. So getting enough sleep at night.
How is that a vice?
Well, if you sleep too much, if you sleep too long.
Does it include with the wrong people?
Oh, no.
No, okay.
We're talking about sleep here.
All right, too much sleep is bad for you.
Too much sleep is...
Too much sleep is bad, but enough sleep is good.
Enough sleep is good. And really what you're looking for is 7 to 8 hours of sleep a night. I can't think of anyone that gets those 7 or 8 hours of sleep per night. Because really that would be what? 10, 12, basically midnight to 8. Or 10 to 6 in the morning, let's say, for a full 8 hours of sleep. That's a lot of sleep, isn't it?
I
get your
know.
8 hours?
I try to get my 8 hours of sleep, but I'm in bed by 8:30.
Well, not getting enough sleep has been associated with hypertension, glucose intolerance, and belly fat. These are all risk factors for heart disease, as you would know, right, because of the heart background.
Oh, I thought you were saying because I'm overweight.
No, because of your thoracic surgery background.
Yeah, I never got enough sleep when I was doing thoracic surgery.
That brings,
Ever.
Yeah.
Yeah, it was just a couple hours, and it was always interrupted by a nurse requesting a sleeping pill.
Were you counseling people on getting enough sleep?
No, I was cursing those people that were waking me up. This was before the days of cell phones.
Oh, the pager days?
Right.
Or was that in the rotary phone days before the pager?
No, Mabel would ring me up.
Oh, Mabel. Well, it is interesting how many physicians out there are not, practicing what they preach. As far as look at you, they put you were actually in a position where you not only didn't get enough sleep. I can imagine your diet probably wasn't where it should be, just because of the time factor. You pretty much lived in the hospital, right?
Right.
And yet you were performing surgeries on people that didn't take care of themselves, get enough sleep, or eat correctly. Right?
Indeed.
Oh, what a vicious cycle.
It paid the bills. It made my first 3 wives very happy.
Well, if you have trouble falling or staying asleep, or you can't seem to drag yourself out of bed on a regular basis, talk to your doctor about the possible underlying conditions, such as, what are some common conditions that you would see with people who...
For insomnia?
Yeah. Anxiety?
How about just not doing enough exercise?
Okay.
How can you possibly expect to sleep at night if you're not exerting yourself during the course of a day.
That's true.
I think exercise is a vital component of a good night's sleep.
How about sleep apnea?
Well, that's certainly an important cause of sleep deprivation, but I think most people are not using the proper techniques for sleep hygiene, which is exercise, not using stimulants such as caffeine or something else before bedtime, watching television up until they nod off. You need a quiet place. It's dark, and all these other things. So sleep hygiene is very important. What do you prescribe for sleep?
Prescribe for sleep?
Yeah, as a chiropractor.
Well, the first thing I would prescribe is, and you hit the nail on the head as far as television. So many people watch that 10 o'clock or 11 o'clock news at night, and it absolutely increases your stress levels. There's always somebody's being shot, someplace got robbed, something bad happened in your neighborhood. These are all things that increase your anxiety and stress levels. And, you know, how restful of a sleep are you? How restful is the sleep going to be that you're getting?
I don't know. My favorite prescription for sleep disorder is a rusty lawnmower. And you have to see the look on patients' faces when I write that out on the script pad. I write down a prescription, and they all think I'm giving them a sleeping pill. And I rip it off, and I hand it to them. And it says, rusty lawnmower. And they ask me, what's this? And I said, it's a rusty lawnmower. You could buy one at the local yard sale on Saturday morning, push it around for a couple hours, and I'm sure you're going to sleep quite fine. If that doesn't work, then you come back, and we can assess you for other sleep disorders.
Absolutely. Exercise, absolutely important in so many different ways, from everything from pain disorders, sleeping disorders, you name it. It can almost all be helped by exercise. In fact, I can't even think of a contraindication for, say, walking. You know, what's a condition that you don't want to walk with?
I'd be hard-pressed to think of one.
How about even a heart condition or a kidney condition, liver?
No. All chronic illness, the first thing we do with any patient that has a wasting disease or a chronic illness is try to condition them. And we use physical therapy and occupational therapy, both to condition the body and mind. So if you don't use it, you're going to lose it. It's very important to use it.
Even with pain, when you're having a back pain or a hip pain or what have you, if you can walk, pretty much for the most part, it needs to be done. As long as you've previously been, examined and you're given the okay from a doctor.
Well, obviously, if you have a disorder of a weight-bearing joint, such as hip or a knee, and it requires treatment, then even with that, you want to maintain range of motion with simple therapies. I'm not saying, I suppose that would be a contraindication to walking, but at the same time, you need to be prepared for any kind of surgical eventuality, such as a joint replacement. It's very important to have your quads and hams and your cardiovascular system in good condition so that you can rehabilitate yourself quickly after operation.
Far better outcomes.
Absolutely.
With rehab before surgery. Okay, here's one. Playing hooky at work. So this is actually good for you. You would think it would be bad, right? Not living up to your responsibilities or whatnot. But really, calling it a mental health day. Just taking a day off for no particular reason, just for yourself, just for 24 hours of a mini vacation, all to you.
Yeah, bull. Don't ever do that. Be a man. Go into work. Live up to your word, and suffer through it. Suck it up.
No, don't.
No,
because it relieves stress. It lowers your blood pressure and your risk for heart disease.
You need stress. Get to work.
No, come on.
Sorry.
Believe it or not, it also promotes critical thinking.
Oh, please. How does sitting on the couch watching Oprah during the day when you should be supporting your family promote critical thinking?
Maybe you start thinking about all the things that you should be doing rather than sitting on the couch and watching Oprah.
I'm sorry, Dr. Yates. I can't buy into that one. Let's keep going.
A study in 2005 showed that women who took 2 or more vacations per year were less likely to be depressed than women who took one every 2 years. I guess that's not
so
playing.
What? We're talking about working people.
Yeah, that's not
There's
really
nothing to do with men.
Oh, come on.
No, if you're a man, you need to get up and go to work. If you're not doing that, there's something wrong. If you're not worried about doing that, and if you're not thinking about working when you're on vacation, that's not normal.
Oh, okay, good. Thank goodness. Gosh, I was worried about that one. All right, a daily chocolate fix. So many people think that having a little bit of chocolate is bad for them. They think that they're not staying on their diet, or they're not eating as they should, because that's not in the FDA regulations for diet. But really, having a little bit of chocolate is absolutely fine.
Just a bissel, just a schmear, just a little bit. Yeah, okay, I can go along with that.
A square or two. And, of course, dark chocolate is better than the milk chocolate, but they both have antioxidants. And that.
Well, what are you supposed to do with the chocolate that's left over if you're just having one square?
You put it back in the refrigerator.
You mean Mr. Chocolate and Mr. Milk are supposed to sit alone in a dark refrigerator waiting for you to come visit them the next day?
Yes.
I think that's very cruel and unusual. I would never leave the two of those alone. I'd finish them both off at the same time.
Well, very, very rarely do I leave chocolate in my refrigerator uneaten, but you're supposed to. So.
Okay.
All right. So dark chocolate, of course, contains antioxidants, flavonoids, but also improves the flexibility of blood vessels by the antioxidants and bioflavonoids.
So, the next time somebody goes to knock the chocolate Twinkie out of my mouth, I'm supposed to convince them it's good for my blood vessels?
Yeah.
Okay. Good deal.
I don't think chocolate Twinkies count, though. This is about chocolate.
Just chocolate.
Yeah, not chocolate Twinkies, not brownies, chocolate cake,
Okay.
chocolate mousse.
Next.
All right. A night out with friends. I guess it depends on how much if you drink with a night out with friends. But really, a night out with friends is supposed to have a very positive effect on your health.
Friends of the same sex or opposite sex?
Just friendships. So friendships are very good for you as long as you hang out with people with whom you have a well-balanced relationship. So this does not include...
There is no such thing as a well-balanced relationship.
Well, this does not include hanging out with a toxic friend, with someone who's toxic for you.
How would you define a toxic friend?
One that brings you down. One that is, maybe they maybe complain a lot, maybe to excess. Everything is negative, and they take you to a negative place rather than both, being together and having a positive experience. That would be a toxic friend.
Well, thank you for explaining that.
Well, all right. We'll be back after the break. Thank you.
You're listening to the Hit and Run Medical Hour with Dr. Jennie Yates and Dr. Marc Blum. She is a chiropractor. He is a surgeon. We have open lines here, 727-441-3000, 727-441-3000. Please feel free to call in with questions, comments, queries, etc. We'll be back right after this break.
At the Oaks of Clearwater, you'll enjoy a lifestyle to fit your needs. From independent living, assisted living, memory care, and skilled nursing. Our exciting independent lifestyle is the perfect combination of freedom, comfort, and security. Enjoy total independence with peace of mind. Our independent lifestyle includes chef-prepared meals in our beautiful waterfront dining room, a continental breakfast, all utilities, including cable and telephone, housekeeping with linen service, scheduled transportation, including trips for shopping, local restaurants, theater, and more. Our activities program is second to none. At the Oaks of Clearwater, you'll enjoy affordable luxury waterfront senior living with $1 million view. Call today, 727-445-4069, and discover where caring, compassionate service really makes the difference.
Good day, Jim Newcomer from Midas Resources. February 8th, 2011. Gold opened this morning at $1351.60. A 1-ounce gold coin can be purchased for $1386.79, $693.40 for a half ounce, or $346.70 for the quarter ounce. That's $1386.79, $693.40, and $346.70.
The Constitution and the Bill of Rights have been reduced to old relics politicians ignore, trample with their outlandish,